Hi, Dr. V here. And due to the extreme temperatures that we've been experiencing for these past couple of weeks, I wanted to take about 5 minutes to talk to you about a condition that can turn deadly due to extreme heat, right? So I had not heard of this condition until about 2 years ago. But because of things I've heard in the news, tragic instances that I've heard in the news about a young football player that passed away during practice, a soccer player that passed away suddenly during a soccer game, a marathon runner that had collapsed and died during a race. I wanted to bring this condition to the forefront. So what I'm talking about is called exertional rhabdomyolysis. Again, exertional rhabdomyolysis. And rhabdomyolysis is RHABDOMYOLYSIS. Rhabdomyolysis. I'm going to call it ER from now on because it's kind of a tongue twister, right? But I do want to read the definition. So, exertional rhabdomyolysis is the breakdown of skeletal muscle tissue due to physical exertion, often resulting in muscle pain, swelling, and weakness. Now, you may say that doesn't sound too bad, right? I go work out, or you go work out, and you have muscle pain, you have swelling, and you have weakness. Okay, that's not what I'm talking about. What that is DOMS, delayed onset muscle soreness. So say you started a new workout program, you got your goals set or whatever, and you start working out. Well, within the next day or 2 days, you start feeling achy and stiff, and you get out of bed, and every movement that you make hurts, right? That's DOMS. That's delayed onset muscle soreness. And you know this because, as I said, a day or two after you work out, you feel it. But it resolves itself within a week. Okay, that's key. With ER, it's more severe. Both conditions deal with muscle damage. However, ER is severe. So it damages the muscle fibers, so much so that it breaks down the muscle fibers into its components. So it breaks it down into myoglobin, to creatine kinase, to potassium. These components then leak into your bloodstream, right? And so how do we get things out of our body? If they're in your bloodstream, they're going to need to be filtered and peed out, filtered by your kidneys and peed out. Well, if you have so much muscle breakdown, muscle damage that has occurred from this intense workout that you've done that's new, along with the extreme heat conditions, because these two things are what makes it occur. So if you have so many components going through your kidneys trying to filter out, your kidneys are overloaded and they can't do it fast enough, that can cause kidney failure, and that can lead to death. So let's talk about it. One of the signs is that if your kidneys are not filtering out these components fast enough, your urine will turn dark reddish brown. Dark reddish brown, like a tea bag color. But I love tea. But it will become like a tea bag color. And so if you're noticing that, your child is out there and they play football or whatever, and they're going to take the bathroom break. I remember seeing all the boys running over to the trees. They take a little bathroom break, but their urine is starting to become very dark. That's a sign, okay? So let's talk about some of the triggers. So again, as I said, one of the biggest triggers, is performing extreme, intense exercise. Something that's new. Extreme exercise in extreme heat. Okay? So you would think about preseason activities like preseason football camp, soccer camp, even military boot camp, right? You're going down, something new is very intense. They don't care what the weather is. You got to perform. So you push yourself, right? Also, it can affect endurance athletes. So you're in a spin class, doing something new, pushing yourself, not drinking water, getting dehydrated. Marathon runners, it can happen to you as well. Maybe you're used to doing just a 3K, not just but a 3K, and then you extend yourself to a marathon, something different, extreme heat, dehydration, high humidity, high altitude. Maybe you've traveled to another location. These are the conditions we're talking about. This is what can set you up to be at risk for ER. There's another trigger, and what made me actually want to talk about this is sickle cell, having the sickle cell trait. That's an underlying cause that can ignite ER. So I hope, I don't know that they're still testing for it, but I know they used to test when the baby was born. So if not, I highly suggest you get your babies tested to see if they do have the sickle cell trait. If they haven't been tested and you know that your kids want to play sports, please get them tested. Of course, so the reports, I will tell you about a report out of the Connecticut Department of Health. In their September 2024 report state that approximately 8% of African Americans in the U.S. carry the sickle cell trait. And that breaks down into 1 in 13 Black Americans have the sickle cell trait. And that's according to the CDC. So with that, athletes need to pay attention to signs of, as I said, dehydration, heat exhaustion, heat strokes. One of the differences, heat exhaustion, you're looking for cold, clammy skin. You're looking for excessive sweating, dizziness, vomiting, nausea. Heat stroke, no sweating. Hot, dry skin. They could even lose consciousness. Okay, confusion. Those signs, just like everybody else, you have to look for that. But if you have the sickle cell trait, that could be a deadly combination. Okay. Let's see. You also have to look in case you are going, as I said before, to a different altitude. Take into consideration these things. So please get your babies tested for sickle cell trait. To prevent these things, hydrate. Drink water. Drink your sports drinks to stay hydrated, to replace your electrolytes while you're out there. Drink frequently. People always say drink water. They never tell you. Like, drink every 6 minutes. You run a play, run over to the side, grab a bottle. If they come out to the field with the water bottles, please drink it, okay? If your coach doesn't know, if your coach is yelling at you, go ahead and Google it on the internet and then give your coach these tips. Be like, hey, people are dying from this. Kids are dying from this. We need a change. Every 6 minutes, you need to be drinking something. Take frequent breaks. And then if you do have sickle cell trait, if you know that you have this, create a plan with your coach or the athletic trainer in case there is a crisis. They need to know what to do. They need to know how to treat it. They need to know that they need to keep their eyes on you while you're doing and while you're participating in this sport. So please take heed. I just feel so horrible when I hear things about these young kids and actually passing away on the field and in practice, and the trauma that it causes to the parents, to the teammates, to the coaches, everybody. And if this is something that I can help educate you about and that can be prevented, I want to do that. So if you have questions, you can reach out to me on Facebook. Well, some people can. Or you can email me at painfree2003@gmail.com. Or you can email me, better one is Back to Life Therapies. BACK, the number 2, LIFE therapies at gmail.com. Back to life therapies at gmail.com. And if you have something that I can answer, I will. If I need to research it, I will. Because I don't know it all. But when I do know, I will try to let you know. Okay, so here's to good health. Talk to you all later. Bye.